So here's a few exercises using body weight for a closed kinetic chain strengthening and activation of the serratus anterior. So typically, there's a lot of different ways to vary this exercise. So one way to progress this is to start up against the wall. So I'm not having the patient use a lot of their body weight with this, and they're just gonna press themselves away from the wall. Patients really tend to wanna shrug when they do this, so that's a cue you've gotta be pretty mindful of. Now, as they're pressing away, you're going to be palpating for the pec. Remember, we spoke a while ago about how you don't want them overly using their pec, especially their pec minor, to make this protraction happen. So I'm going to make sure that as they press forward, they're really hollowing out their chest. So I can palpate here, and this muscle is really soft. And I know that the muscle now that they're using is their serratus anterior to protract, and they're not overly using their pec. So I may have them do some repetitions here. They can get to about 15 or 20. I may want to progress them to now they're about a 45-degree angle. I can do this here because I've got this molding, like a little ledge. So now I'm in this sort of plank position, and I'm going to do the same move, but now I'm using a little bit more of my body weight. Same exact motion. I'm not shrugging, just really going into protraction. So now from here, I can do a couple of things. A lot of times what I'll do is once they get to a point where this is easy, they can do 15 or 20 with no problem, I may switch them into the one arm push-up position. And then they can really isolate one side versus the other, watching for all the same muscle activation patterns here in the pec. So another position you can do closed kinetic chain scapular protraction and activation of the serratus anterior is in quadruped. All the same rules apply. I'm doing the same things, I'm just in a little bit of a different position. I'm protracting, and I'm really trying to hollow my chest out. I know it's hard to see, just when you're practicing this on your own, see if you can get the hang of protracting in this position without activating your pec. It's trickier when you're prone, in these prone type positions, just because you're starting to use a little bit more of your body weight. You can do this in a push-up position. That gets pretty tough for people. So just as as an option, if people are having an easy time with this and you want to keep strengthening, it's the same move, but it's pretty tricky to not use your pec in this position, but it is possible. A note is when you're asking your patient, where are you feeling this? You don't want them feeling it in their pec muscles or their lats, flaring their lats or anything. It's sort of this very ambiguous burn somewhere behind the shoulder blade. They often kind of can't describe it. But that's where you want them to feel work, if at all, versus in one of the larger muscles, the pec or the lat. So these are all different options in closed kinetic chain protraction and activating the serratus anterior.